that Moderna says it can fit more medicine in each vial and is asking the FDA to try to approve the move, which, Meg Terrell, I'm assuming would help us speed up the rollout even more, correct?
That's exactly right, Brian. So I've heard that the idea here is to alleviate a bottleneck in the manufacturing of COVID-19 vaccines, which is actually in the capacity to do what's known as fill finish, actually taking the bulk vaccine and putting it into vials. So what I've learned is that Moderna has asked the FDA to authorize it to put 15 doses in each vial, up from 10. Essentially, there's not a shortage of the vials. It's that there are a finite number of companies that have these super sterile manufacturing facilities that can do what's known as fill finish. And so the hope would be this could speed up supply by about 50% if you're getting more doses of existing vaccine into vials, Brian. So we haven't heard from the FDA yet on this. We will have to see how quickly they can do this. But if so, it could alleviate one of the bottlenecks that is holding back vaccines, Brian.
Yeah, and just a quick follow on that, because when you see the vial, I mean, as I have, I mean, it's minuscule. It's like literally the size of a quarter. But you've got to administer it quickly because we know that it goes bad over a couple of hours. I guess one issue is, can they use all those? Would nurses and other people that are, going to deliver the shots be able to deliver them that quickly?
It's an important question, and we know that the fact that there are 10 doses per vial and the vials are so delicate, you have to use them all at once. This could create more logistical complications. Another thing about this is this vaccine doesn't have preservative in it. So presumably the company would have had to show data that, you can get 15 doses out of one vial without a preservative and still have it meet those, incredibly sterile requirements that the FDA has. But, if we can get more vaccine out, that would be the goal.
Yeah, and, on the case front here, listen, just under 100, that's still way too many. Any's too many. Cases are still elevated, but they have come dramatically down from their highs. I looked at Texas this morning, Meg. A month ago, Texas had 27,000 cases. Yesterday, 9,900. We are seeing that trend, maybe not to that level in other parts of the country.
Absolutely. I mean, we were just showing that wall with cases coming down 40% from their peak in early to mid-January. That's great news. Hospitalizations are also down. We've got about 95,000 people in the hospital. That is still a tremendous number of COVID patients in the hospital, but it is down about 20% from its peak. In terms of deaths, that's a lagging indicator, and that should come down as well, too, but we're still at 3,300 deaths being counted every day in the country. Now, whereas these are very good, signals that trends are coming down, public health experts are really worried about these variants. B.1.1.7, the one first identified in the UK, has now been identified in 32 states, more than 400 cases. We have very few cases of the B.1.351 variant. One was just identified over the weekend in Maryland, in addition to those two in South Carolina, and one of P.1 in Minnesota. Those ones are the more concerning ones, Brian, because of their ability to evade our vaccines and potentially our drugs as well. So even though things are getting better, public health experts say we got to double down to make sure these variants don't take over.
Shepard Smith here. Thanks for watching CNBC on YouTube.